Hi everyone, this is Rosie Annear, Mayor of Mount Alexander Shire Council, and I thought I'd just talk a little bit more about our recently adopted Municipal Public Health and Wellbeing Plan from 2025 to 2029. So this again will guide our priorities over the next 4 years as a council, and it's really focused on how we can improve the health and wellbeing of people living within our shire. So there's a lot of information in this plan about, I guess, the current state of where things are, and there's a lot of statistics, and some of them, some of them are not great statistics, and I think we need to, we do need to be mindful that there are a lot of people who are not feeling good or not feeling their best at the moment, and we need to find ways to continue to support people to feel healthy and well. So we've got 6 priorities in this plan. The first one is improving wellbeing, and this obviously is very important. We do have an above average amount of people here who live with a psychological problem and who potentially have psychological distress. We know that people really are struggling at the moment. So this initiative is really about how we can attract more services to the Shire. We need those place-based local services for local people so that they can be supported where they live. And we're also looking at, more ways that we can improve connection, because a lot of the other thing that we find is that people are lonely and isolated. So looking at ways to, co-locate things so that people have that connection to others when they're doing everyday activities. Our second priority is around increasing healthy eating and food security. So we know that a lot of people are struggling with this at the moment as well, with the cost of living crisis. It is really important that everyone has access to food and to good and healthy food. A lot of the actions in this are around developing sustainable food networks, continuing to support food pantries, working with community groups and sporting clubs to ensure that their food offerings are on the healthier side, and really supporting things like farmers markets and people to grow their own food. The third priority is increasing active living. So again, we know that not enough people get the recommended amount of exercise in their lives. There are a lot of people who are not able to be active for whatever reason, and this priority is around how we can help people to be more active in a way that they feel safe and supported and included. So a lot of the data that will inform this will come out of the active living survey that was done this year. We're waiting to get that data. But a lot of the things we can do are, and it does come down to active transport in terms of footpaths, cycling paths, ways for people to walk into town or walk between places and be active in a way that doesn't feel too hard and is supported for whatever age and ability they have. Our fourth action is around alcohol and drug related harm and reducing this harm, because again, we know that a lot of people who live in our shire do use drugs and alcohols at a level that is perhaps not healthy. We have, and this translates into, can translate into mental health problems as well. There is not a lot of support here for people who are struggling with drugs and alcohol, particularly for young people. So this is around how we can help people who maybe have a problem, who are supporting someone who has a problem, or who just feels like they'd like to change the way that they use drugs or alcohol. I think we'll be doing a lot of work in this space over the coming years, and especially, again, I'll just say, trying to support youth who are on a tricky journey at the moment, some of them. Our fifth action is around tackling climate change and its impacts on health. This is something that we need to do continually because the climate continues to change. And things that we can do here are around increasing canopy and shade, having cooling centres and cooling hubs, and doing a lot to build resilience in the community to respond to extreme weather occurrences or other climate change related kind of emergencies. This is something that we absolutely need to work with community on. And finally, our last action is around preventing violence and promoting gender equity. So this is around preventing violence for everyone, but we do know that women experience violence from men at an above average rate, and the statistics are very scary. Even within our own shire, we have high rates of family violence, and through work with young people have identified that there are some real gendered problems happening as well. One of our big actions here is to reinstate and resource the local family violence network so that service providers and all the organisations that work in this space are on the same page and can offer help in a strategic way. Also, and continually we will do this, is advocate for more place-based services to respond to people who are suffering from family violence or violence in general. So these are just a few of the initiatives from our Municipal Public Health and Wellbeing Plan. It looks like this. This is one of our lovely maternal and child health nurses who we are very lucky to have, and I'm really excited to get stuck into this and try and make our shire healthier and people's wellbeing even better.